Today, I'm answering one of the most common questions I hear in consultation. Upper versus lower eyelid surgery. Which one makes the biggest difference? And I want to start with a simple, honest answer. There isn't one universal winner. The biggest difference depends on what's aging first on your face, what your natural anatomy is, and what specifically is bothering you when you look in the mirror. But the reason this question matters is that the eyes are the focal point of the face. When the eye area looks tired, heavy, or puffy, the entire face can look older, even if the rest of the face still looks great. So making the right decision between upper and lower eyelid surgery can be one of the most high-impact, natural-looking improvements a patient can make. Let's break this down clearly. First, let's talk about upper eyelid surgery, also called an upper blepharoplasty. The most common reasons people consider upper eyelid surgery are they feel like their eyes look smaller than they used to, they have extra skin that rests on the lid, they notice hooding over the lash line, or they feel like their eyelids look heavy, especially later in the day or in photographs. Some patients also say, I'm lifting my eyebrows all the time without realizing it, because subconsciously they're trying to open the eye area, and that can lead to forehead tension and deeper forehead lines over time. Upper eyelid aging is largely about skin laxity. The eyelid skin is thin and it stretches. In some patients, there's also a component of fat fullness that can make the lid look heavier. Upper blepharoplasty is designed to remove excess skin and in some cases a small amount of fat so that the eyelid contour looks cleaner and more open. Now, a key point, a good upper blepharoplasty should not change the shape of your eyes. The incision is placed in the natural crease and the goal is to restore a natural looking lid. When it's done properly, patients don't look operated on. They just look more awake and refreshed. People often get comments like, "You look rested," or "You look great. Did you change something?" That's the ideal outcome. In certain cases, upper blepharoplasty can also be functional, meaning it can improve peripheral vision if the skin is heavy enough to block the field of view. But even if in purely cosmetic cases, it can be an extremely high-impact procedure because it opens the eyes and brightens the expression. Now let's talk about lower eyelid surgery, or the lower blepharoplasty. Lower eyelid concerns are usually different. Patients typically come in saying, I have bags under my eyes, or I always look tired, or no matter how much I sleep, I still look exhausted. They may also notice under eye puffiness, shadows, or a deeper groove between the lower lid and the cheek. Here's what's important to understand. Under eye bags are not always about lifestyle. They're often structural. As we age, the support structures around the eye change, and the natural fat pads can shift forward. The skin also becomes thinner and less elastic, so the under eye area can develop bulges and shadows even in very healthy patients with great sleep. Lower blepharoplasty is designed to improve the under eye contour, and modern lower blepharoplasty is not simply about taking fat out. In fact, removing too much fat can create a hollow look, and hollow under eyes can sometimes make you look older. So in many patients, the goal is to smooth or blend the under eye area in a natural way, sometimes by carefully reducing fullness, sometimes by repositioning the tissue, and sometimes by combining with skin tightening when needed, and also redraping the fat. So when someone asks me which makes the biggest difference, upper or lower, I guide them to think about what problem they're actually trying to solve. If you look in the mirror and the main issue is that your eyelids look heavy, your eyes look smaller, and you feel like the upper lid skin is weighing the eye down, upper blepharoplasty or upper eyelid surgery often makes the biggest difference. If you look in the mirror and the main issue is that you look tired because of under eye bags, puffiness, or shadows, lower blepharoplasty often makes the biggest difference. And here's another important point. Many patients have both, but not everyone needs both. The best plan is individualized. Now let's talk about a common mistake people make, trying to treat the wrong problem with the wrong tool. For example, some patients try to use filler under the eyes when what they actually have are true under eye bags from prominent fat pads. In those cases, filler can sometimes make the area look heavier or more swollen or worse. On the other hand, some patients have under eye hollowing without significant bags, and in those cases, filler may be a great option without surgery. That's why evaluation matters. Simply and similarly, some patients focus on crow's feet or forehead lines and assume Botox will fix the tired look, but Botox doesn't remove extra upper eyelid skin or under eyelid bags. Botox can often soften your expression lines, but eyelid surgery addresses structural changes. So what does the decision process look like in a consultation? I evaluate the eyelid skin quality, the degree of hooding, the presence of under eye puffiness, the position of the cheek, and the overall balance of the eye area. I also consider your natural eye shape because the goal is always to preserve your identity. Then we talk about what bothers you the most and what kind of result you want. Subtle refresh, more dramatic improvement, or something in between. Let's briefly talk about recovery because that also influences decision making. Upper blepharoplasty usually has swelling and bruising that improves significantly within 1 to 2 weeks. Lower blepharoplasty can also have bruising and swelling, sometimes a bit more, depending on the technique and your individual healing. Either way, most patients look presentable within a couple of weeks, but the finer refinement continues as the swelling settles. So here's the takeaway. The biggest difference comes from treating the area that is truly driving the tired look in your face. Upper eyelid surgery opens and brightens the eyes. Lower eyelid surgery smooths puffiness and reduces that exhausted appearance. And for many patients, the most natural answer is a customized approach, upper, lower, or both, based on anatomy. If you're wondering which one you need, the best step is a consultation, where we can evaluate your eyelids and give you an honest recommendation for the most beneficial natural result. So if you want to talk to us, please call us at 518-583-4019 or go to www.saratogaspringsplasticsurgery.com.